Thank you, Chairman and members of the committee. I'm Rachel Flom. I'm the Executive Director at the Economic Progress Institute. And we at the Economic Progress Institute support an increase in the minimum wage, ideally to at least $15 an hour. But we are pleased to support even $1 as in the sub A. I would say that to my colleagues in the business community who say that we need to look at where we should be, that our workers need to be higher than 15. We know, we do a study every year that what family and an individual needs to live. We know that a mom with 2 kids needs $30 an hour in order to meet their basic needs. We're not talking extravagant lifestyle, we're talking basic needs. We're not asking for a $15 hour minimum wage bill, but we need much higher than our $10.50 that we have right now. We know that our Massachusetts and Connecticut neighbors are on a path to 15. We need a predictable path, and we should have a path like they have. Mass is already at $12.75 an hour. Connecticut's at 11 and going to 12 in September. What that means is that we're losing workers to those states. We've had retail businesses tell us they can't hire frontline staff because people can go right across the line to Massachusetts and make $12.75 an hour, or they can go to Connecticut and make almost 12. We also know that we have a crisis in our caregiving workforce, both for those who take care of young children and those who take care of our senior population. Again, those are low-wage workers who can go right across the line and work in our neighboring states who have higher minimum wages. If the federal minimum wage had kept pace, it would be over $20 an hour. $10.50 is not a wage that people can support themselves on. We heard that mostly it's teenagers. That is not true. Included in your packet today is a myth buster that shows that the reality is the average minimum wage worker is 35 years old. 30% are 40 years or older. 60% are women, 25% of them have children, 50% of them work full-time. These are not students that we're talking about supporting. These are parents with children who are trying to make ends meet in our state, and we should support them better than $10.50 an hour. Lastly, we know that increasing the minimum wage supports communities that have been left behind. We know that it would support 1 in 2 Black and Latino workers and 2 in 5 women. I also have included in my testimony contradictions to the arguments that businesses are hurt by that. If you look at the studies, overwhelmingly, that has not been shown to be the case. New York City just increased their minimum wage to $15 an hour and saw no negative impact. We know that the money that goes into families' pockets with increased minimum wages goes right back into the local economy, and we think that, and we know also that studies are increasingly showing the health benefits of making sure that people have a living wage. Studies recently are showing how suicide rates go down when we increase the minimum wage. I mean, if you think about your own life and whether you could balance your budget on $10.50 an hour, I think we can all agree that we couldn't, and we need to do better for our workers and families. I'm happy to answer any questions.
Senator Lombardi.
Thank you. Rachel, one of yours, the handout that you sent us, the colored handout, is telling to me. And every year we get the minimum wage bills and we look at these, and we learn that the stereotype that we have that the minimum wage is designed to be the kid in high school who is earning a part-time job and supplementing the family income. And then we have studies that say, you say 89% are not teens, 30%, 32 are over 40. Is there a monetary chart somewhere that can tell us what category demographically everybody earns at the minimum wage level?
So this is showing you who are earning the minimum wage. So this is the current population of minimum wage earners are not children. I mean, they are older people.
Okay. No, I get that. The point I'm trying to make is, are there any states that you're aware of that will somehow differentiate when we talk about a living wage versus a minimum wage? That a wage designed specifically for students in high school earning a minimum wage, as opposed to that 32% of those folks over 40 years old who are actually trying to raise a family with
Sure.
that money?
Well, I would argue that even if they are teenagers, we know that a significant number of teenagers who are earning the minimum wage are supporting their families. I mean, if you think about if the minimum wage is as low as it is, they may need to have multiple people in the family earning minimum wage in order to meet their family budget. So I don't think it's correct to assume that just because someone is a teenager, they shouldn't get paid a livable wage, because they may be supporting other people even if they don't have their own kids.
Any other questions? Senator Golden.
Thank you. Rachel, could you just reiterate, the passage of this bill as it's currently drafted would mean that in October, our minimum wage would go up to, I believe, $11.50 is what the sub-A says. But what would it be in October of 2020 in Connecticut and Massachusetts, and what's the predictability of their minimum wage?
Yes, so on the first chart, you can see the path. I didn't spell out all of the numerations for Mass and Connecticut, but as of September of 2020, Connecticut's will go up to $12 an hour, and we'll be on a path to 15 by 2023. So it will go up, I think it's 75-cent increments until it gets to 15 in 2023. Massachusetts just went to $12.75 an hour this January, and they also will increase it 75 cents till they get to 15 by 2023.
Thank you. And if I may, a follow-up question. And so given that the vast majority of minimum wage workers in the state are not teenagers, we know that they also include a lot of different categories like CNAs and healthcare providers, and while I'm sure, since I see Nicole here, I'm guessing SAU can also weigh in on this, but I'm curious about what you think that means to the workforce and the quality of the workforce in Rhode Island and people crossing the border into Massachusetts and Connecticut who are already working low-wage jobs that are fairly difficult and taxing to themselves if they can cross into Massachusetts and Connecticut and earn $1 to $3 or up to $3.50. I might be doing the math wrong there, more dollars an hour. What will that mean for our workforce?
Right. No, I think we're really concerned about both the senior caregiving workforce and the child care workforce. I work mostly with the child care population, and we hear time and again that people cannot hire qualified staff. So there are wait lists for our infant and toddler classrooms. It's hard work caring for both babies and for our senior community, and we need to support those people so that they won't go across the line. Because right now, if they can go work at a fast food restaurant even across the line in Massachusetts and make more money than they can make doing the backbreaking work of caring for an elderly person, then that would seem like a logical decision for these people who also have to support their own families.